Hi, everyone. My name is Kelli Butcher, and I am a nurse, and I work for the Arkansas Department of Health. I may look familiar to some of you. I have been in classrooms many times talking about various health topics, and that's basically what I'm doing again today, except I'm not standing in front of a health classroom because you all are no longer in school. What I want to talk to you about today is public health. And the reason I want to talk about this topic with you today is I want to help you understand what public health is, what public health does, and how public health has been involved in the decision that you stay home from school. This might be a scary time for some of you. You know, being asked to stay at home and not go to school for a long period of time is something that hasn't happened ever to any of you all. And it's a very rare occurrence in general. And so being asked to stay away from other people, being asked to not go out to restaurants and eat, the things that we're being asked to do because of public health is puzzling and scary for a lot of people. So I want you to understand why we are doing what we're doing so that you can do your part to not only keep yourself healthy and safe, but to keep those people around you that you love and care about healthy and safe as well. So I'm going to start off by sharing my screen with you here so that you can follow along with this presentation as I do it. Let's try this again. Now, there we go. So let's talk about Public Health 101. We're going to talk about several different topics today. Some of them are listed there on the screen for you. I'm also at the end going to address the COVID-19 virus that you're hearing so much about in the news and online, and the reason why you're home from school again. But let's start off by talking about some definitions and some key terms and even a person. Charles Edward Armory Wilson is a leading figure in the development of the modern study of public health. His definition of public health that was developed almost 100 years ago is public health is the science and art of preventing disease, promoting life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. So you can see from that definition that public health involves all of us. It involves us as individuals. It involves us as communities and organizations and society in general. I want to also talk about some terms that you might hear me use. You know, when we think about healthcare, people tend to think about that top definition there, clinical care, health care that you receive either to prevent, treat, or manage an illness that you may have when you go to your doctor one-on-one, or you go and see a nurse one-on-one. That's what most people think of when they think about healthcare. But I want you to, again, learn what public health is and how it works and why it's important in what we're experiencing today. A determinant is a factor that contributes to the generation of a trait. A determinant are factors that influence health statuses of individuals or populations. We'll talk about that more later in the presentation. And then the next words there are epidemic or outbreak. And I want to throw in the word pandemic as well, because that's what we're experiencing now. And I know for some people, if not a lot of people, the words epidemic and pandemic are a little bit scary. So I want you to understand the definition and the meanings of these words, because the words themselves shouldn't be scary. An epidemic is nothing more than an occurrence of an illness or a behavior that's happening at higher levels than we expect. So you may have heard about the vaping epidemic. What that means is that's a health-related behavior that's occurring at a higher level in excess of normal than we should be seeing. A pandemic is an epidemic that has spread over several countries or continents, and a pandemic usually affects a large number of people. And then a health outcome is a result of a medical condition that directly affects the length or quality of a person's life. Now, if we were in class right now, I would ask somebody to raise their hand and tell me what they think the answer to this question is. But since I can't do that, I want you all just to read this sentence and decide for yourself. Do you think the answer is A or B? Do you think public health aims to provide groups of people or individuals with the right to be healthy and live in conditions that support health? I hope from what I've told you so far already that you realize that it's groups of people that are addressed by public health. And again, that's why you're asking to do or maybe not do things right now, because we are trying to protect and help groups of people using public health right now with the coronavirus pandemic that we are all living through. Next question. What is this definition? What's the word that would fit in the blank? Blank is a disease occurrence among a population that is in excess of what is expected for a given time and place. And the answer, of course, to that one is C, epidemic or outbreak. Now, let's look a little bit at the history of public health. Some of the things that public health does, and oftentimes these things occur kind of behind the scenes so people aren't aware that public health addresses these types of issues, but sanitation and environmental health. This is one of the things that the Department of Health still has a hand in. We still make sure that sewage is disposed of properly when somebody builds a new home, for example. But sanitation and environmental health started way back in about 500 BC. We know now that even back then, Greeks and Romans actively practiced community sanitation measures to protect groups of people's health. Then in the 1840s, about 2,000 years later, the Public Health Act of 1848 was established. And that Public Health Act provided a central board of health and placed responsibilities for sanitation in the hands of the boroughs in the United Kingdom. And then in 1970, the United States, under President Nixon's administration, established the Environmental Protection Agency, or the EPA, and the EPA protects human health by safeguarding our air, water, and land. So public health is involved in sanitation and environmental health. We are also involved in pandemics. Again, that's what I'm really wanting you to understand about today. This is what we're dealing with and living with and going through today. But this is not the first time that we've ever experienced a pandemic. Influenza, or the flu, has actually caused pandemics many times during the both distant past and more recent history. Almost a century ago, there was a pandemic of flu that infected about 500 million people across the world, killed millions of people. More recently, in 2009, we had what we were called the swine flu, and there were people in 214 countries that were infected with this flu. And the health department was involved, and public health was involved in preparing for and controlling the effects of those influenza outbreaks, and will remain preparing and controlling flu for the foreseeable future. Then, historically, polio was also a highly feared disease because it was a severe illness that caused people to become paralyzed. And if the paralysis was bad enough, they couldn't even use their muscles to breathe. And polio is a disease that caused death among thousands of people each year. In 1955, a vaccine was introduced to give people immunity to that disease so they could not catch polio. And polio today is one of the immunizations that you're required to receive before you can attend a school in Arkansas. And in 1988, public health got involved because we were having outbreaks in more than 125 countries of polio, and there was a real initiative that was started to eradicate polio. And today, polio exists only in a very few countries. It's not something that here in the United States we ever think about or even worry about, because people are immunized against polio here in the United States. During the 1980s, human immunodeficiency virus, or HIV, emerged and spread rapidly across the globe. Public health responded to this pandemic by developing new ways to diagnose and treat those who were infected. New infections of HIV are down 20% over the past 10 years, which is a sign that what we're doing is working. We still have things that we can do, and we would like to eradicate this disease just like we've done almost with polio and with other diseases like smallpox that no longer exist in the world. We are still working to get rid of HIV in the world in which we live. We also help prepare for disasters, both natural and man-made. Biological warfare was used to infect people and animals during the siege of Kaffa in the 14th century. The attacking forces used plague, which is a bacterial infection, as a weapon on their enemies. And their actions started the first stage of the Black Death, which you may have heard of from history. In the immediate wake of the terrorist attacks of September 11th, public health workers were on the ground at the World Trade Center and at the Pentagon, conducting surveillance to identify outbreaks and diseases or other possible health conditions that resulted from the attacks themselves. They also monitored the health of the first responders. Those are the people that were there helping immediately during and after the disaster. So your EMTs, your paramedics, your policemen, your firemen. Public health was monitoring those people after the event, also monitoring environmental conditions to detect health threats during the cleanup after the attack. And then in 2005, after Hurricane Katrina, public health also stepped in and dispatched teams for surveillance for illness and injury among those people that were evacuated to shelters and other places of refuge after that hurricane. We also do what we do by implementing policies and working to get laws and policies passed. Public health works to protect and improve health, not just by responding to disease outbreaks or preparing for natural or human disasters, but again, also by implementing policies that support these efforts. As far back as 1500 BC, Leviticus, one of the books in the Bible, is believed to be the first written health code in the world. The book deals with personal and community responsibilities and includes guidance regarding cleanliness, health behaviors, protection against contagious diseases, and isolation of people that have contagious diseases. During 2000 to 2004, cigarette smoking was reported to be responsible for $193 billion in annual health-related economic losses in the United States. Laws banning smoking in the workplace were passed. Laws banning smoking in other public places were passed to protect non-smokers from the effects of secondhand smoke. And these laws were also passed in the hope that it would encourage smokers to quit smoking. And then finally, we have more than a third of US adults that are obese. And public health is involved in efforts to highlight fat, sugar, and salt content in foods through labeling requirements. We also promote physical activities in schools and in workplaces. And another example of public health working to combat obesity is in New York City. The mayor and the city council attempted to ban sodas larger than 16 ounces in an effort to combat obesity. So they tried to say you can't buy sodas in a larger amount than 16 ounces, thinking that that might make it harder for people to consume large volumes of these sugar-sweetened beverages to help with that fight in obesity. Now, here's another question for you. We've talked about all these things so far. Which of these four things were a pandemic in our public health history? We talked about all of them. Do you remember the ones? There is more than one that were pandemics. And the answer to this is influenza, or again, the flu, and polio have both been pandemics in our history. Now, let's look at a public health approach and how a public health approach works. Regardless of the topic, people that work in public health take the same approach to problems, following 4 general steps. First of all, we ask, what is the problem? We have to identify the problem using data collection and monitoring of health events and behaviors to figure out what is the problem. After we've identified the problem, the next question is, what is causing this problem? For example, there might be certain populations that are more susceptible, more likely to catch a disease. There might be something in an environment that is causing certain people to choose certain behaviors. So we look at those risk factors. What is the cause of the problem? And then we want to ask the question, what intervention is going to work to address this problem? We look maybe at what has worked in the past. If in addressing the same problem or a similar problem, and ask ourselves if what we're thinking about doing makes sense with the population that's being affected. And then the last step that we do is we ask ourselves, how can we implement what we're wanting to do? If we think this is the answer and what's going to work, how are we going to make that happen? Do we have the resources to make that happen? Do we know enough about the affected population to know that this is going to work? And we're going to talk a little bit more about the public health approach, and then I'm going to give you a story from history about how the public health approach actually works. But what I want to do first is I want to tell you a little bit about sciences that are involved in public health. First of all, we have public health surveillance, and that's the science of monitoring a health situation. That's the science that we're using right now to collect data about people that are testing positive for COVID-19 in Arkansas right now, today. Epidemiology is the science that helps us determine where the diseases come from, how or why they are moving through populations, and what can we do to prevent them. And then we have to have our laboratories that can perform tests to say, yes, this person does have this disease, or no, this person does not have this disease. We have both public laboratories and private laboratories, and both of them support public health by testing for specific diseases, as well as conducting research and training people. We also have what we call public health informatics. You know, a lot of the documentation that we use in healthcare is electronic. And public health informatics is the science of using that data that's collected and compiling that data and presenting that data in such a way that we can use it effectively to address a public health situation. So now I want to tell you the story from history where the public health approach was used. During the early 1800s in London, there was a disease called cholera that was going around. It was a fatal intestinal disease. It was running rampant, meaning lots and lots and lots of people were catching cholera. And it was a disease that caused death to tens of thousands of people, often within hours of their first symptoms. So they got sick, and before 24 hours even was up, they had already died from this disease. Now, keep in mind that at this time in our history, people didn't understand bacteria and viruses. They didn't understand that bacteria and viruses is what were causing diseases in many cases. And the popular opinion for cholera was that it was being caused by bad air from rotting organic material. John Snow, who was a doctor in Britain at that time, had a different opinion about cholera. He believed that the illness was spreading by way of contaminated water because sewage was being dumped into a river that were near the town's wells that provided their people with water. Because of his work tracing the source of the cholera outbreak, Dr. Snow is often considered to be the father of epidemiology. His research changed the way we look at diseases. So now let's apply the public health approach to what Dr. Snow did, and so you can see again how public health works. First of all, he said, what is the problem? And he conducted surveillance, gathering data, looking at where those people lived that were diagnosed with cholera, and he noticed that there were large clusters of the cases occurring in specific areas. You can see this red circle there in the middle of your screen. This red circle depicts the neighborhood in question, and those black dots that you see represent deaths from cholera. Notice that there are many more black dots around Broad Street. Dr. Snow was assisted by a gentleman named Henry Whitehead. They tracked down and interviewed cholera victims and their families and then mapped out the outbreak. Their efforts highlight the benefits of linking science with community and everybody working together to solve the problem. The next thing that Dr. Snow did is he examined the data and tried to figure out the risk factors. Remember, that was the second step in following the science of public health. And on this map, you can see that those big square black boxes are where pump sites are located in the city. This map, what it shows is that the largest number of cholera cases occurred in areas near neighborhood water pumps. This observation prompted Dr. Snow to research the distribution of water pumps in London. And he asked people, where are you going to get your water? Because remember, a lot of people don't have running water in their houses at this time in history. And so he is identifying where the people who are getting cholera, where are they getting their water? And his findings indicated that the cholera cases were more often located around certain pumps, and especially that Broad Street pump, which is where you see that red square in the middle of your screen. And through his research, Dr. Snow came to the conclusion that water from that Broad Street pump, using that water was a primary risk factor for becoming ill with cholera. And so after identifying this risk factor, the next step in the public health approach is figuring out what you need to do about it. What interventions are going to work? With the water supply from the Broad Street pump identified as the risk factor, Dr. Snow then worked to identify interventions to address the problem. Through his research, he understood that the interventions needed to control the outbreak were going to have to stop exposure to the contaminated water, and on a larger scale, stop the water from becoming contaminated in the first place. So, using the final step of the public health approach, Dr. Snow implemented his intervention by removing the handle from the Broad Street pump, because if there's no handle on the pump, people cannot use this pump to get water. And then they were not using that water, not exposing themselves to cholera, and not then getting sick. And after a long battle with politicians and water companies, Dr. Snow finally convinced the British government that water contaminated with sewage was the source of cholera and other diseases, and policies and laws were implemented for water sanitation. This one's a hard one, I think, to answer, but what do you think? Each public health core science helps us to protect and promote public health by providing people that are working in public health with the answers and information that they need. Now let's look at some of the core functions and essential services of public health. Public health, the three core functions of public health are assessment, policy development, and assurance. Assessment is knowing what needs to be done. Policy development is being part of the solution to get it done. And assurance is making sure that it actually gets done. The core functions, again, assessment, policy development, and assurance, have to be carried out at all levels of government. federal, state, and local, in order for public health systems to function. So let's look again at tobacco and the way public health was used to combat the problems that we have had with people using tobacco. So you can see things that were done at all levels, the federal, state, and the local level. So thinking about locally where we live, what things could be done. In the assessment step, we figure out how many people are using tobacco at the local level, and then passing laws maybe that say people can't smoke in bars, and then making available resources to people to help them quit smoking. And then at the federal level, again, doing things on a much bigger scale that affect the entire United States, or Arkansas, again, doing things that affect all of Arkansas. And that's how the core functions of public health work through the government. Let's now look at determinants of health. If you think back to that first slide that with the definitions on it, determinants was one of the words on that slide. And determinants, again, are factors that determines a person's state of health or a population's state of health. Scientists generally recognize these health determinants for any population. So what do I mean? What does it mean by genes and biology? Well, it means things like what's your gender, how old are you, what genetics did you inherit from your parents? These are things that we have no control over. We have no control over how old we are or what genetics we inherited from our parents. Health behaviors, the choices that we make for ourselves. What things are we choosing to do that have impacts on our health? Things like choosing to smoke or not smoke, making different choices related to eating, making choices related to physical activity. Societal characteristics, the third thing on the list there, what that determinant means is our health being affected by where a person lives, their income, air quality, water quality, sanitation qualities where they live. And then the last determinant on the screen that you see there is medical care. The health care that's available to you, the insurance coverage that's available to you. And oftentimes people think that these are the things that really affect people's health in the biggest way, but I think you might be surprised to see this next graph. And what you'll notice on this pie graph is that medical care only accounts for about 25% of our health. The remaining 75% of what determines our health as a person and as a population is our environment and the choices that we make with our behaviors as they relate to health. Now let's talk specifically about COVID-19. That's again the virus that is spreading through our communities now, causing the disease that we're seeing that's causing us to stay home from school right now. Again, public health is involved in trying to slow the spread of this disease so that our healthcare system can manage the people that are getting sick. What we know about how it spreads is that we know that we don't have a vaccine yet to prevent this disease. So you can't go to your doctor and get a vaccine like for polio that we talked about earlier to help prevent you from catching this. The best way to prevent this illness is to avoid being exposed to it. So that's why you're being asked to do and not do certain things right now. That's why we have lots of businesses closed. That's why you can't go out to a restaurant and eat right now. That's why none of you are in school. We're trying to prevent people from being exposed to this virus. The virus is thought to spread mainly from person to person between people who are in close contact. And you see there it says within about 6 feet. That's why you're hearing so much about social distancing. We want people to spread out if they're in public places. We don't want you within 6 feet of another person because they might have this virus. And through respiratory droplets, if they sneeze or cough, you might catch this virus from them. These droplets, if they sneeze or cough, can land in mouths or noses of people who are nearby, or they can even be inhaled into lungs if somebody is nearby. The other thing that these droplets can do is they can land on surfaces. And we are learning that this virus, depending on the surface, can live sometimes for even days. So that's why when we talk about in a little bit, cleaning, that's why cleaning is so very important. If you've got somebody that has sneezed or coughed on a surface, you might come into contact with the virus by touching the surface and then touching your face. What can you do to protect yourself? The very best thing that you can do to protect yourself, not only against this virus, but against all illnesses, is wash your hands. Clean your hands often. Wash your hands with soap and water for at least 20 seconds. And that means 20 seconds of scrubbing, not 20 seconds from when you walk in the bathroom to when you walk out of the bathroom. Scrubbing the backs of your hands, scrubbing in between your fingers, cleaning underneath your fingernails. And doing these things, especially after you've been in a public place, after you've blown your nose, after you've coughed or sneezed. And if soap or water are not available, you can use a hand sanitizer, but you want to make sure that that hand sanitizer contains at least 60% alcohol. Rub it all over your hands, not just on the palms of your hands. Make sure you're getting that sanitizer in between your fingers and on the backs of your hands. And try to avoid touching your eyes, nose, and mouth with unwashed hands. That's the way the virus is getting into our bodies. We get it onto our hands by touching surfaces, and then we touch our faces, and the virus gets into our body in that way. We need to take steps to protect others as well. We need to cover our coughs and sneezes. We need to cover with a tissue or use our elbow, not using our hands to cover our mouths. We need to throw these tissues immediately into the trash and then wash our hands with soap and water for 20 seconds, like I've already mentioned. If soap and water, again, are not available, you can use hand sanitizer. I'm going to show you a video on the correct way to wash your hands at the very end. And again, I want to make sure that you realize that it's 20 seconds of scrubbing, not 20 seconds total. And if you've never timed yourself washing your hands, I can almost guarantee you that you're not scrubbing for 20 seconds. 20 seconds sounds like a really quick period of time to scrub, but it actually feels much longer when you're doing it. So you'll hear in the video in a minute that it says sing the happy birthday song twice. That takes about 20 seconds. So try that the next time you wash your hands. While you're scrubbing, sing the happy birthday song to yourself twice, and don't stop scrubbing until you're finished with those 2 songs. You also need to stay home if you're sick. You know, sometimes people think, I'm just going to power through it. I'm tough. I can go to school anyway. I can go to work anyway. I can go to the grocery store and get my errands run anyway, even if I don't feel that good. But we need you to stay home if you're sick. If you're sick, the only reason you need to be leaving home is to get medical care. And we need to be cleaning and disinfecting our surfaces that people touch daily, that multiple people touch daily. So think about those things as you go about your day in your home or in your life, and think about those surfaces that everybody's touching: the doorknobs, the light switches, the car door handle, the keyboard on the computer, your cell phone, the toilet, the sinks and the faucets. Clean the surfaces with soap and water if they're dirty, and then use some kind of a disinfectant cleaner that will kill germs after that. You also want to pay attention to symptoms. And again, I know this is a scary time that we're all living in. For some of you all, you're thinking, oh my gosh, this is so bad. What I want you to realize is people that have become infected with the COVID-19 virus, 80% of them have mild symptoms. So most people have mild symptoms. That's why it's so very important, if you're not feeling healthy, to stay at home. You might think, oh, this can't be it because I don't feel that bad, but it could be, and you could be giving this disease to a person that is going to have much more severe symptoms. So what we're really trying to do in asking people to social distance and to stay home is we're trying to slow the spread of this disease. Our healthcare system is unable to manage even 20% of our population needing to be in the hospital or have medical care all at the same time. We're trying to spread out the period of time where people are going to get sick so that everybody is not needing health care at the same time. Know that once you have been exposed to the virus, it takes anywhere from 2 to 14 days until you start to feel bad. So if you learn that one of your friends or your family members have been diagnosed with COVID-19, know that for the next 14 days, you need to stay away from other people. And if you develop things like fever, cough, or shortness of breath, you need to call your doctor. Fever, cough, and shortness of breath are the most common symptoms of COVID-19. They are not the only symptoms, however. Again, some people have very mild symptoms, maybe feel just like they have just a common cold even. But you need to seek medical attention if you or somebody that you know or love has developed trouble breathing, persistent pain or pressure in their chest, if somebody is confused or you can't wake them up, if their lips or the face appears to be bluish, grayish, weird color, they don't look right. These are things where you need to get medical attention immediately. Keep in mind also that this list does not include everything that you might see. And how to seek help. As I mentioned earlier, you might learn that one of your friends or family has been diagnosed with COVID-19 and you know that you have been around them. If you think you've been exposed and you develop these symptoms like we talked about, like cough, fever, cough, or shortness of breath, don't just show up at your doctor's office. Call the doctor's office first. And I understand it would probably be your parents doing that, but make sure that they understand you don't want to just walk into medical facilities because, again, we're trying to slow the spread of this illness. And again, I am going to basically wrap up my presentation here before I let you all watch the video, but I want to finish by saying we will get through this. It is a really weird, scary, tough time that we're going through, but if we all work together, we can come out of this on the other side, learn about this virus, and keep ourselves healthy and the people around us healthy as well, and do what we can from a public health perspective to slow the spread of this virus. So let me show you now the video on proper hand washing, and I hope to see you all soon back in the actual classroom.
Hand washing is one of the most important ways you can keep from getting sick and spreading germs to others. Dirty hands spread disease. This hand washing demonstration will show you how hand washing can get rid of germs and chemicals that get on our hands every day. This gel is like the germs and chemicals that we get from things we touch throughout the day, like our toys and pets. If we then rub our eyes, nose, or mouth, or pick up something to eat, the germs or chemicals can get into our bodies and make us sick. Studies have shown that people touch their eyes, nose, and mouth about 25 times every hour without even realizing it. To get rid of these germs and chemicals, CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water. Turn off the tap and apply soap. Then, lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. If you don't have a clock nearby, keep scrubbing until you've sung the Happy Birthday song twice. Rinse your hands well under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dry them. Washing your hands using the steps we just demonstrated is very important to get hands completely clean. Let's see how well we got rid of the germs and chemicals. Great. No more germs and chemicals. Why is this so important? Germs and chemicals from unwashed hands can get into our foods and drinks when they're being prepared or when we're eating or drinking them. which can make us sick. Also, germs and chemicals from unwashed hands can be transferred to other objects like cell phones, tabletops, or toys, and then transferred to other people's hands. That's why it's so important to wash your hands following these steps. Wet, lather, scrub, rinse, and dry so you can stay healthy and help keep those around you healthy. For more information, visit cdc.gov/hand washing.